All right, welcome to Chapter 5, Introduction to Pathophysiology. So, going back to the last chapter when we talked about medical terminology, the term path means disease, and then physiology is the way things work. So, pathophysiology is the study of how disease affects the human body. So, knowing signs and symptoms of different diseases can help us identify problems or medical conditions that our patients might be experiencing. Cardiopulmonary system and perfusion. So, cardio meaning heart, pulmon meaning lungs. So, that's referring to the lungs and the circulatory system. So, perfusion, we mentioned in the last chapter, but that is the constant supply of oxygen and nutrients to the cells by blood flow. So all of the components of the cardiopulmonary system must be functioning. So oxygen is delivered all the way to the alveoli and the carbon dioxide transported all the way out. There has to be enough available blood, functioning pump, our heart, and enough pressure to make the exchange happen. So the way I look at the cardiopulmonary system and the exchange of oxygen and carbon dioxide is like a massive railway system with two stations. So our blood would be the train and the vessels would be the tracks. One station is in the lungs at the alveoli, and then the other station is at the capillaries. So we breathe oxygen into our lungs. It goes down to the capillaries, and which is a train station. The oxygen gets on the train, meaning the blood. The carbon dioxide gets off the train and is breathed out. The oxygen on the train is then transported throughout the body and stops at the other station, which is the capillaries, which is the very smallest blood vessels. And oxygen gets off and carbon dioxide gets on. So, and then it just keeps repeating that process. I hope that makes sense. It's helped me to understand it throughout my career. So when hypoperfusion and shock, so shock is actually just the lack of adequate perfusion. Hypo meaning low, so there's low perfusion. So when perfusion fails, that's when we have shock. So the cells become hypoxic, meaning they don't have enough oxygen. And then we switch to anaerobic metabolism. And then lactic acid and waste, they build up, and then the cells eventually die. So their cells, they need a constant supply of blood. And the reason for that is because blood is delivering the oxygen and the nutrients and getting rid of the waste. The constant blood supply is known as perfusion, and that relies on making sure our cardiovascular and respiratory system are working together. Now, whenever there's a disruption of fluid balance, like edema or swelling, so edema is like you see it a lot in elderly patients when their ankles and their feet are all swollen, and the problem is that's fluid trapped outside of where it should be, and it's usually caused by leaky capillaries. So that fluid's leaking out of the cells of the capillaries into the outside space where it shouldn't be. So the cardiopulmonary system is basically just the cardiovascular system and the respiratory system working together. The respiratory system is what brings the oxygen to the bloodstream, and the cardiovascular system transports it around the body. And it also takes the carbon dioxide and back to the respiratory system, which then exhales it. So, like we mentioned previously when we were talking about anatomy, the airway consists of, or the respiratory system consists of our airway, our lungs, and our muscles of respiration. So let's think about it. A patient's fluid balance can easily be assessed externally. So we can look for dry mucous membranes, sunken eyes, tachycardia, low blood pressure. All those things can indicate dehydration. And then you get that swelling, the edema in the ankles and feet. And that can be an indication of poor fluid distribution. So things are backing up, or it can be caused for whatever reason. Aerobic and anaerobic metabolism. So metabolism comprises the chemical and physical processes necessary for maintaining life. So aerobic metabolism uses oxygen. Okay. Now, whenever you see they add an AN or an A at the beginning of a medical word, it typically means without or not. So anaerobic metabolism means without aerobic metabolism. So it's abnormal, it's less efficient, and it doesn't use oxygen because it's without aerobic metabolism. It can be life-threatening. It occurs when people are having heart attacks or when they've lost a large amount of blood, because you lose a large amount of blood. Blood is what transports the oxygen around our body. The respiratory system comprises the airway. So movement in and out of the chest requires a patent airway. We can have upper airway obstructions that can be caused for any number of reasons. It could be a foreign body, it could be choking, it could be trauma, it could be an altered mental status. Our lower airway complications, that's when you get into your asthma, your COPD, your bronchioles constrict, there's resistance in the airway, so less air reaches the alveoli. Our lungs, so our diaphragm and chest wall are responsible for pressure changes that stimulate breathing. Our tidal volume is air moved in and out in one breath. So remember that. So tidal volume is the air that's breathed in one breath, in and out. Dead airspace or dead space is basically just the air that remains in the space between the mouth and the alveoli. So, for instance, our trachea doesn't collapse, our bronchioles don't collapse, so there's just this dead space, typically about 150 milliliters. I'm sure that's totally dependent on the size of the patient, but that's typically about what it is average, and it is called dead space. So the respiratory system can obviously dysfunction, and that could be caused by stroke, brain tumors, infection, toxins and drugs, or spinal cord injuries, diseases, any number of things. If there's disruption of the pressure, like the chest cavity is a closed container, but if for whatever reason there's a hole in the chest wall from a gunshot, a stab, whatever it might be, that can disrupt that pressure. And what changes the size of our chest cavity is the diaphragm, ribs, and intercostal muscles. So intercostal is the muscles between our ribs. So cost means, I want to say rib. Inter means, within or in between, and then all means pertaining to. So intercostal means, pertaining to the muscles in between the ribs. So the lungs are attached to our chest wall with two membranes. So you have your parietal pleura on the chest wall and the visceral pleura on the lung. And then between your lung and the chest wall, you have your pleural space. And that can get blood or air in it, whether it's from, a stab wound, or maybe it's still closed and there's just air in there from trauma. So that makes a disruption of the pressure. So the expanded chest cavity for normal respiration creates a negative chest pressure and lets air in. And then when it relaxes, the chest cavity creates positive pressure and forces air out. So we have normal atmospheric pressure, and when our chest cavity is lower pressure-wise than atmospheric pressure, air comes in. When our chest cavity has a higher pressure than atmospheric pressure, air rushes out to equalize. If there's a hole in that chest wall, it affects the changes in pressure. So there can be blood in there, or there could be air. If there's blood, hemo meaning blood, that means there's blood in the thoracic chamber. Or pneumo meaning air, there's air in the thoracic chamber, which takes up room for the lung to expand, and then the lung can't expand. Respiratory system dysfunction, disruption of lung tissue. So we can actually damage lung tissue, and that interrupts the ability for gas exchange at the alveoli. So something's happened at that train station. It can be caused by trauma, pneumonia, which is there's fluid in the lungs, infection, reduced oxygen levels, and increased carbon dioxide levels. Our body does a pretty good job of compensating though. So our brain is, that supercomputer is watching the carbon dioxide levels in our blood, and if they get too high, it'll increase our respiratory rate and our tidal volume, which is how much air is breathed in one breath, if that's correct English. I'm not sure. But it also will slow down our respirations if we don't have enough carbon dioxide. So cardiovascular system, the blood, it's the transport system of the body. It's that train. If there's not enough train cars or not enough blood, then we have poor circulation. Not enough oxygen can get around. Blood vessels are pathways. Remember, arteries. So this is where I struggle. It says carries oxygenated blood away from the heart. I would take out that oxygenated. Yes, that's true 99% of the time. But if you just remember that arteries go away from the heart and veins go to the heart, you should be able to figure it out. Arterioles, after our arteries, they get smaller and smaller. Eventually they become arterioles. And then from there they go to the capillaries. The capillaries, that's the train station. It offloads oxygen, picks up carbon dioxide, and takes it out of the body through the respiratory system. So blood vessels are pathways. So here is where that arteries go away from the heart and veins go to the heart comes in handy. So pulmonary arteries, so they are arteries, right? But they carry deoxygenated blood. So you have your pulmonary artery, which goes from your heart to your lungs. It's going away from the heart, so it makes it an artery, but it's unoxygenated because it's going to the lungs to get oxygen. Then your pulmonary vein, while it's a vein, it has oxygenated blood. So it's pulmonary, so it's coming from the lungs, going to the heart, so that makes it a vein, but it happens to be oxygenated this time because it's coming from the lungs with oxygen. Our blood pressure, so that's created by the beating heart to move blood around the body. So our blood pressure, typically they say normal is 120/80. So the high number, the systolic blood pressure, is the pressure in your vessels when the heart contracts, and the lower number, the diastolic number, is the pressure in your vessels when the heart relaxes. So our blood vessels can change diameter, and that, as well as the volume of the blood that we have in our bodies, directly affects the pressure. So dilated vessels and blood loss decrease pressure. So you think of your blood vessels as a container. If they suddenly widen, they suddenly dilate, then the container is much bigger, but the fluid amount stays the same. But your pressure is going to drop because there's so much more space. You become hypotensive. The heart is our four-chambered pump designed to move blood. So we've got our two upper chambers, the atria, and the two lower chambers, the ventricles. Stroke volume, similar to tidal volume. Tidal volume was the amount of air that you breathe in one breath. Stroke volume is the amount of blood pumped in one pump, or one contraction of the heart. So your cardiac output is the amount of blood ejected from the heart in 1 minute. So you would take your stroke volume, the amount of blood pumped in one pump, times it by your heart rate, and that would give you your cardiac output, which is how much blood is pumped in 1 minute. Obviously, if the rate is too fast, output actually decreases. So in order for you to, what helps me understand that is I think of a sponge. If you take a sponge and hold it under the faucet, it's going to absorb a bunch of water, and then when you squeeze it, that water is going to come out. But if you don't relax your hand all the way, it won't fill completely back up with water. So if you're squeezing the sponge over and over again so fast that it never has time to get water back in it, obviously the water you're squeezing out of the actual sponge is going to go down. The same is true of the heart. So if the heart is pumping too fast, which is typically greater than 180 beats per minute in adults, it's not allowing it enough time to fill up with blood. So obviously that's going to cause less blood to be pumped out. So our autonomic nervous system, the one that just does its own thing, it adjusts based on our cardiac output. So we have our sympathetic, which is our fight or flight. So that's when, our adrenaline starts pumping. We're getting ready to either run for our lives or fight for our lives. Our parasympathetic response is also known as the rest and digest nervous system. So that's what relaxes us, makes us chill out. Heart failure. So heart failure, there's different types. We can have electrical, which our heart could be tachy, which means fast. So tachycardia means fast heart. Brady means slow. Bradycardia is a slow heart rate. Or ventricular fibrillation. And when something fibrillates, like our heart, basically it's just quivering. It's just out of control. There's too much electrical stimuli going all over the place. And that is a life-threatening. Ventricular fibrillation is one of the shockable rhythms that an AED will shock. There can be mechanical failure to our pump caused by trauma, squeezing of the heart muscles, loss of cardiac muscle due to cell death, like in a heart attack. So we mentioned that we're pretty good compensators. So the sympathetic nervous system compensates for low perfusion or hypoperfusion. So our vessels will constrict, our heart rate will increase to try to pump blood faster, our pupils dilate, our skin sweats, and our brain responds to increased levels of carbon dioxide by trying to breathe deeper and faster to get rid of it. Now it's important to note too that peds are way different than adults. So probably I would say probably over 90% of pediatric cardiac arrests, maybe more, maybe less, but it's a super high number, are caused by respiratory arrest first. So they compensate much differently than adults. The problem with the thing with adults is we compensate and we slowly decompensate, and we can watch our patients slowly decompensate when they're adults. The problem with kids is their main compensation mechanism is to increase their heart rate. So they can vasoconstrict really well, which allows them to maintain blood pressure when they've lost a lot of blood. This is a problem though, because we'll be taking blood pressures or whatever, and it gives us a false sense of security because, well, their pressure is fine. Well, the problem with kids is they're burning oxygen a lot faster, and they can compensate, and then all of a sudden they just can't. So they seem normal, and then boom, they crash. So we have to really keep a close eye on our pediatric patients for subtle changes, and always err to overtreat than to undertreat. So recognizing compensation, it's an important part of what we do in our assessments. It can help us rapidly determine when a patient's in shock. So we need to be looking out for those signs of shock, like increased heart rate, decreased blood pressure, and abnormal respiratory rates, whether it's too slow or too fast.